Hello all, this is Dr. Alsup, and in this video we will be working through how to identify the structures located in the posterior, or the last of the three compartments of the thigh that we are going to discuss. So when discussing the posterior compartment of the thigh, we are talking hamstring muscles. That's often what you hear them referred to as. These all share a proximal attachment on the ischial tuberosity, which will be deep under, kind of like in this region here. And there are three hamstring muscles, or three muscles of this posterior compartment of the thigh. Two are going to be more medially placed, and one is more laterally placed. So this is medial, and this is lateral. And I can tell this is lateral because I see the gluteus maximus up here. And I can see it attaching to the iliotibial band, or IT tract, right here. And this IT band is always going to be laterally placed. So the lateral hamstring muscle is going to be the biceps femoris. I kept trying to say biceps brachii in my head, and that is we're way off there. So no, this is the biceps femoris. It will actually extend more proximally here, but you can't see it quite well in this part of the image. And as its name would suggest, there are two heads of the biceps femoris muscle, but this short head is located deeper. So we're looking at the long head here. You'd have to do a deeper dissection to see the short head. So this is the more lateral hamstring muscle, and the biceps femoris will extend and distally attach on the head of the fibula. There are two medial hamstrings. You're going to have the semitendinosus, which is in this general region right here. And the semitendinosus is going to be more superficially placed, or more posteriorly placed, than the deeper semimembranosus, which you can see here-ish. And look what you have going on right here. You have that gracilis. That is always that most medial muscle when we're talking about the thigh. So I always sometimes, even when I'm in the posterior compartment, sometimes I try to find that gracilis muscle because it is just so typically placed. Okay, so that semitendinosus muscle, again, is going to be sitting kind of on top of the semimembranosus if you're looking at this view. And its tendon is often much more rope-like than the kind of flatter tendon that you see of the semimembranosus. In fact, for the semitendinosus, oftentimes this tendon is visible for a little bit more of its length than you have here on this individual. But as always, variation is key, right, in anatomy. So biceps femoris is going to, or femoris is going to be more lateral. Semitendinosus is going to be superficial to the semimembranosus in its most typical patterns. These muscles are innervated by the tibial division of the sciatic nerve for the most part, except for that tricky short head of the biceps femoris. But it's important to note that in most individuals, it is still the sciatic nerve in the thigh. So in other words, it is still wrapped up as one nerve in the thigh region. So say this is a cross section of the sciatic nerve. You have the nerve fibers of the tibial division kind of all over the place here. And then you have the common fibular and its nerve fibers all over the place here. But they're still all wrapped up together in one nerve called the sciatic nerve. So within the thigh, it is still just that one nerve wrapped together. It's not until you get to the popliteal fossa, which is this posterior knee region, what we're looking at right here, that you get the sciatic nerve splitting into its terminal branches. So, where you can actually see this occur grossly. So the tibial nerve will be the larger one, and it kind of looks like it's heading more medially in this particular view. And then the common fibular or peroneal nerve is the smaller division, and it's going to be moving a bit more laterally in this particular position. So it is this tibial nerve or tibial division of the sciatic nerve that's going to supply those hamstring muscles. All right, most excellent. Thank you for your time and attention here, and have an excellent rest of your day.